Welcome to the second session of the community medicine, and particularly we are talking about the essential terms which are frequently used in preventive and social medicine. Last time, while introducing on last Thursday, I had come out with several terms which were just to pave the way. These terms were primordial prevention, primary prevention. Can you recall it? Secondary prevention, tertiary prevention, environment, and these all essential terms were linked to the specific terms like, say, epidemiology. That's why how these are linked with each other. We are talking about prevention and need to talk specifically more about the emphasis on primordial prevention. Today, we will be focusing on only primordial prevention and primary prevention. Many times, this is asked as a short note and sometimes as a full question in the examination. But in life, it has a tremendous role to play for any medical person. Ideally speaking, it has a role to play for any human being. Just tell me a name of somebody who is not interested in his own health. I think everybody is interested in the health. Nobody is interested in the disease. And my dear friends, if we understand the term primordial prevention, primordial means basic, बुनियाद जिसको हिंदी में कहते हैं, basic, ancient, from time immemorial, known since ancient times, that is primordial. That means it is almost, the term has taken birth with the birth of the human race. It is primordial prevention. And simply means that the human being knows about it. We know about it. But unfortunately, because of this so-called jargons of infrastructure and development and all these things, science and technology, everything is good. But if we forget the base, perhaps the good turns out to be bad. And that's what is emphasis on it. Now the Western world has started learning about primordial prevention, particularly in the situations of the chronic diseases. And that has come to India also. We in India are also now suffering with the chronic non communicable diseases like cardiovascular conditions, cancer, diabetes mellitus, etc. And that's why what lessons the Westerns have learned from the primordial prevention, incidentally, we will have to revise our own science. Actually, primordial prevention is the pure primary prevention. You can tell it as a pure primary prevention. Why? Because it applies even before a risk factor takes place. Say, it's not talking about a risk factor like obesity, but before the obesity comes to the body, whatever we can do for that, that is primordial prevention. And naturally, when we talk about this, primordial prevention is something which is part and parcel of our own life. And this can be applied before the risk factor comes to us. How wonderful it is. This can be applied into the groups, specific groups also. We can ask some specific groups like, say, those who are likely to be at risk. We can talk about primordial prevention. Actually, the countries have started country strategies for primordial prevention, and they target it for the prevention of the chronic diseases because they are now tired of it. Chronic diseases require a lot of hospitalization. The cost factor is very high. And earlier we were targeting hypertension, treatment of hypertension, identifying the blood pressure, taking blood pressure, then going for the hypertension, newer drugs for the hypertension. A time came when everybody got tired. They started finding out what are the risk factors for the hypertension. And lo, they have come out with something oh, obesity is a risk factor for the hypertension, for diabetes mellitus. But that was the second step. Actually, they should have taken the first step. What leads to the obesity? And that's the lifestyle, the behavior of an individual most of the times. And that's why if we target starting from the very early childhood, even before that, in the antenatal period, before that, before a young lady becomes pregnant, before that, during the adolescence of a woman, then this is something which avoids the risk before the risk even takes place. And that is primordial prevention. Now we have come to the stage when people, the countries, developed countries, they are talking about let us avoid the risk before it comes to us. See, and we should not be late for that. Perhaps if we miss this train, we will be in a very bad shape to treat the hypertension, etc. Can I tell you an example? Because the current situation is that of the COVID-19. We are talking about the respirators, ventilators, and high-fi treatment which is required by a person who is undergoing the respiratory failure or the failure of the body systems in case of the COVID infections. But what was before that? Before that, he would have got infected because without infection, he cannot become a patient. How was he infected? Because he did not observe the social distancing, because he did not find himself within the house which was already preached to him. My dear friends, the doctor is not required for advocating the social distancing. Our Prime Minister has already told about that. What we need to learn is, say now they are talking about Namaste. The Namaste has been age old in this country, and we learned from the Westerns to shake hands. Now we are telling that, oh, our civilization was very great. Where were you till this time, my dear friends? Prevention is better than cure. Now you are talking about all these things. I am proud of that preventive and social medicine happens to be my subject. I am really respecting all the clinical people. But perhaps if they can understand the preventive medicine, large number of patients can be avoided, the load will be avoided, and they will be beautifully treating the remaining persons. That will be the case. Our costs will be minimum. Our infrastructure will be required minimum, because what we require in the primordial prevention? Let me tell you, because primordial prevention by and large requires health education. How simple the word is. It doesn't cost a single naya paisa most of the times. And then the same terms which we are using, say we target early. Early means as early as possible. Maybe, as I told you, during the intrauterine life or immediately in the infancy. So what are we doing? Say, providing an antenatal mother with the iron tablets. Okay. Before that, an adolescent girl with the iron tablets. Before that, to any girl who is a young girl, like say 5 years to 9 years, providing iron supplements. That is something which is required. It has been required since long, but applied very late. That's why, similarly, exercise. Everybody needs exercise. The body requires exercise. I need not emphasize much more because you all know about that. Contraction and relaxation is part of the life. If you don't contract, if you don't relax, the musculature will be very, very frigid. It cannot work properly. That's why, my dear friend, exercise, good food habits. That is what is nutritious food. These are the basic things which everybody should say, and avoid bad things like smoking and alcohol. In the last paragraph of the last lecture, I had told that. My dear friends, even if I take 100 lectures on preventive social medicine, please remember this lecture, because primordial prevention is the true, pure primary prevention. It doesn't require a single naya paisa. It is preparing ourselves before any threat comes to our life, any threat comes to our health. It is cultivating our own immunity against any virus, any bacteria, come what may. That's the spirit. And it's that spirit doesn't cost anything provided you apply it in the right way. This can be applied on the individual basis, this can be applied on the mass basis. But who will apply that? There has to be some mechanism for that. People are just worried about which drug should I take, which doctor should I consult, what is the good specialty, where should I go? My dear friends, please remain healthy and make others healthy. That's the essence. I will be talking frequently about the primordial prevention. It is the basic, it is the ancient art of living with a promotion of health. It is living before the risk factor even enters into the body. And that's why I move to the next part, primary prevention. In primary prevention, what do we do? Before the onset of the disease. Now, one step late. We are already knowing that there may be some risk factors, there may be some disease, but before it comes, we take some step, and that is primary prevention. The person is apparently healthy, he does not have any sickness, he is healthy, and now whatever he does is primary prevention. And in primary prevention, you need to know the stages. Generally, any agent or a pathogen or something that causes the disease or a condition that comes to the body, and then it causes the disease. When it comes to the body and the body is affected with, that is known as pathogenesis. That is formation of the pathology within the body. But in the stage and the before pathogenesis, that is pre-pathogenesis, whatever we do is known as primary prevention. Is it clear? Once the pathogenesis is started, there is no fun of going for the primary prevention. Before the pathogenesis starts, we go in the pre-pathogenesis stage. For example, we are worried that the young children who are born with less than 2.5 kilogram of weight, they are low birth weight babies. Their survival rate is little less, and lower the birth weight, more the chances of dying. In that scenario, what should we do? We should prevent the babies with low birth weight. How? We can feed the mother in a way, we can provide the antenatal care in the best possible way. Naturally, this is primary prevention. We are preparing ourselves for the war. Even if the war comes later on, we shall be the winners. And that's why what I say is primary prevention is the best prevention out of all preventive measures. Secondary, tertiary, we have talked about that. But focus on the primordial prevention, primary prevention. How to do it? Protect your general health and well-being. Can you go back to the WHO's definition? It is the state of well-being. I am healthy, I want to remain healthy. My dear friends, the country requires this slogan. I am healthy, I want to remain healthy. And I will try my best to remain healthy. Actually, at the level of Prime Minister or somebody who is a very good leader, this should start that I don't want to sick. So forget about sickness. I want to remain healthy, and that's why general health and well-being must be promoted. Secondly, think about quality of life. The quality, full of bliss, pleasure, happiness, and enjoyment, satisfaction. You see, this comes from within. This does not come from outside. That's why quality of life is very important. You have everything, big bungalow, big garden, sofa sets, and all furniture, well furnished house, but you have hypertension, you have diabetes, you have depression. What is the fun of that life? Quality of life means you are healthy physically, psychologically, and socially. That's the life. So, quality of life, promotion of the disease, and then wherever it is possible, we protect ourselves from any possible damage. जब जब कोई लड़ाई होती है तो पहले किला बना देते हैं. The fort has to be built. So we keep ourselves protected in the way for preventing the disease and prolonging the life. Some people say that once we prevent the disease and prolong the life, that's all. No, that's not all. The positive health is beyond that. Not only the disease comes to us, not only the years in the life are added, but a life becomes real good life, a quality life, and that is positive health. Think positive, be positively healthy. That's the slogan. And preventive medicine is definitely a subject which deals with that issue. We do not want to generate patients. No. Unfortunately, if there are patients, they must be treated in the best possible way by our respected clinicians. There is no doubt about it. But why to become a patient where the prevention is possible? What is required? Requirement is that of attitude. Attitude that I will continue to be healthy. In whom? In each individual of this country, this nation, in each individual of the world. Once the attitude is developed for the life, we love life. Do not go on talking about mortality. Do not go on talking about morbidity. Yes, that's the case. It's a reality. But focus. Focus on life. Tamaso ma jyotirgamaya. Don't blame the darkness. Go to the light. Mrityor ma amrutam gamaya. Don't blame the death. Go to the amruta, a life full of bliss. And this is who has told this? Our rishis in India. They have said this to us. Tamaso ma jyotirgamaya. My dear friends, preventive and social medicine has the first task to do is the primordial prevention and primary prevention. How this is to be done for the self, for our family, for our community, for our nation. Once we do that, what can happen? You see, the developed countries, so called advanced countries, had already taken the advantage of this primordial and primary prevention. What did they do? Even during 1901 and 1945, there was no medicine for the tuberculosis. The West has already eliminated tuberculosis with the help of the raised living standards. Should I repeat this statement? जीवन की शैली को अच्छी बना के ही उन लोगों ने उन दिनों में 1901 से 1940 तक टीबी को हरा के रखा था. There was no medicine for that. What did they do? They believed in the primary prevention. They believed in the clean environment. No doctor helps for that. Doctor is a human being, may be part of this process, but every one of us will do that. In a case, WHO says that there should be two strategies for that. One, a mass strategy for the entire population, for the groups of the population, and another is a high risk policy. Those who are probably at risk for, suppose the parents are diabetic and the son is thinking that perhaps he may have inherited the gene for the diabetes, he is at high risk. Somehow the child has been obese from the birth, he is at high risk. Somebody who has his father or mother having some depression, he is at high risk. In such cases, we need to have two policies. One for the mass. Everyone should be focused for the primary prevention and primordial prevention. And second, those who are at high risk, for them, we need to do something. And this can be done for modifying the lifestyle, modifying the risk factors, and perhaps eliminating the risk factors. If we do that, perhaps CHD, coronary heart disease, diabetes mellitus, cancer, hypertension can definitely be taken care of. In the earlier part of the last century, 1850 to 1950, the developed countries has fought with the primary prevention and primordial prevention against the communicable diseases. Pure water, good food, and clean air. They did it. And they are getting the fruits of it. But now they are focusing on the same strategy because they forgot in between. The same strategies for their own lifestyle. We could neither do the first one and trying to do the second one, but we will do. Once we are committed, we will certainly see that the communicable diseases can also be removed simply with purer environment. Because as a person of preventive social medicine, we know that no disease can take place in a clean environment, particularly communicable disease. And no non-communicable disease can come to us provided our habits, our behavior, our lifestyle is proper. My dear friends, I am going to talk on this much more because to me, primordial prevention and primary prevention is the essence of preventive and social medicine. Though we are doctors, we forget that we are human beings and we need to be healthy forever. My doctor friends should also be healthy and healthy forever. Do they do exercise every day? Do they take right type of food? And do they take right type of rest? If that's yes, we are always positively going ahead. We meet next time, my dear friends. Till that time, bye, bye, and thank you for being with the Vasudeva Institute of Comprehensive Health and Research. Thank you once again. Thanks.